My weight was holding me back in many ways. Airplanes, roller coasters, playing in the yard with my niece and nephews, everyday activities. Some of the complications I had with being overweight was fatty liver disease, high cholesterol, pre-diabetic, so they held me back with my health a lot. I heard about bariatric surgery. I had a best friend of mine, her mom went through it. I've known a few people I had worked with that had it. I called my primary care doctor and talked to her a lot about what the procedure was, and she sent me to Dr. Bonacci and had me talk with him, and I was super nervous going into it. And I just went to a seminar at Mid-Michigan Health, and they were all so supportive, and they just talked a lot about the surgery and what was going to happen before and after, and they're very supportive. My husband and my mom were my ultimate supporters. They're always there. They're going to push you along, give you support, help you find support. I had an awesome support group with my husband and my mom. With having my bariatric surgery and all the support groups so close to home, it was so nice not having to drive hours to get to where I needed to be, and I could go to my appointments after work, and it was nice to have it close to home. I had a bariatric weight management team who helped me figure out all my doctor's appointments, what I need to do prior to surgery, and they really helped me get a calendar set out and get all my doctor's appointments on there, and they're very helpful. I had to go to 2 nutrition classes. I went to 2 bariatric support groups. I seen the psychologist for psych evaluation. I had to see my primary care doctor for 6 months prior to surgery. I was very anxious going into the surgery, but I knew I was making the right choice, and I was super excited and a little nervous at the same time. My surgery went very well. I had a couple complications after surgery, but those were just minor, and I was in the hospital for a few days and was able to go home, and as soon as I got home, I felt like $1 million. Pain was very mild, and I was very happy. This is definitely not an easy fix. There's so much that goes into having bariatric surgery. After surgery, I was on a liquid diet for 2 weeks, pretty much just liquid, just water, liquids, broth. And then 2 weeks after that was pureed foods, so anything you can put in a blender, peas, green beans. And then after 2 weeks with that, it was very mild, low soups and stuff that was easy to chew up really well to swallow. Your body has a really good restriction still on your stomach. I can only eat about 4 bites and I'm done eating, but I focus on eating my proteins first, and then if I have room for fruits and vegetables afterwards, I will. But I eat about every 2 hours on the hour. 3 months after, I had so much more energy. I was confident. I was ready to tackle the world. I have lost 115 pounds total. It was almost exactly half of my weight. If you're thinking about bariatric surgery, go to a support group. They have them all the time at Mid-Michigan Health in Alma and Midland. They have them all the time, and people are so supportive, and they will never push you into something you don't want to do. If it sounds like something you want to do, go for it, because I wish I would have done it a long time ago.